Assalamu alaikum. We are talking about the nasal cavity and the paranasal sinuses. We have external features. It's formed from the skin and subdermal periosteum plus the nasal cartilaginous structure. This is the external feature of the nose. Inside, what is called the nasal cavity. The nasal cavity. The nasal cavity. The external feature of the nose is forming from the bridge, the root, the apex, the alar region, the dorsal of the tongue, nasal septum plus the nares. This is from the lateral view, while the anterior view, if you look also, you see the root of the nose, the apex of the nose, and what's called tip of the nose, the nasolabial groove here, the philtrum here, you see, the vermilion border of the lip, which is connecting between the tips and the lip with the philtrum in the midline of the face. Plus, this is the nasal septum. As we say, the bone formation, cartilaginous formation of the external structure of the nose. Nasal bone, maxillary process. This is the which is called frontal process of the maxilla. Here, if you look to the lacrimal bone, all these structure forming the medial wall of the orbit. This is here involving cartilage, the alar of the nose, the septum of the nose, and a small, what is called minor alar cartilage. The blood supply of the external of the frontal part of the nose is formed from the ophthalmic nerve through the infratrochlear and external nasal nerve, plus the infraorbital branch of the maxillary nerve. So, in the nose, two combination of the nerve supply, the ophthalmic branch plus the maxillary branch of the trigeminal nerve. While the blood also, it is involved by three vessels from that vessels from ophthalmic, maxillary, and facial arteries. The nasal cavity, if you look here, extended from the nostril, this is the nostril, to the end, beginning of the pharynx, which is called the nasopharynx. That posterior, which is called posterior concha, and the posterior coni behind, like a door of the, which is called anterior nasal opening and posterior nasal opening. And in between, it is the nasal vestibule, just inside. This is what is called the nasal cavity. This is the nasal cavity, and it's the beginning of the pharynx. And this is the internal door of the nose. This is the internal door of the nose, which is called nasal, what is called nasal conine, or apparatus, nasopharynx apparatus. The nasal cavity divided into left and right nasal cavity. In between them, there is a bone which is separated by cartilage and bone, which is the perpendicular plate plus the vomer bone plus the cartilaginous septal cartilage. The boundaries of the coni, the posterior coni or the posterior orifice. Inferiorly, the horizontal plate of the palatine bone, if you look here. Laterally, the posterior margin of the medial plate of pterygoid. This is here, the pterygoid, medial pterygoid plate. While medially is the vomer bone, here. In the roof, anteriorly, is the ala of the vomer here. And the vaginal process of the pterygoid process. Of posteriorly, also the body of sphenoid. So in the nasal cavity, what we have? We have two parts which is involved. One, it is the olfaction in the roof. Second, and we have the air passages from the nose to the pharynx to the trachea, plus the nasal vestibule. So nasal cavity divided into right and left, separated by septum. We have a nasal vestibule. We have a respiratory region, the largest part of the nasal cavity, and we have the olfactory region here in this area. It is supplied by the first cranial nerve, the olfactory nerve. The function in this cavity, it is warm blood and mucus. Warm mucus and blood in this area. Plus the secretion guarding the nose by the hair in order not to enter to the respiratory system the dust or any foreign body. The boundaries of the nasal cavity, as you said, in the floor, the hard palate, plus the horizontal plate of the palatine bone. While in the roof, if you look here, in the roof, what you have a sphenoid bone, the body of sphenoid, you have a cribriform plate of ethmoid, you have a frontal bone here, you see, and you have a nasal bone, you see, and plus the nasal cartilage. So the structure we have in the roof of the nasal cavity are 5. Sphenoid bone, cribriform plate of the ethmoid, frontal bone, nasal bone, plus the nasal cartilage. Any question? This is the detail of the 3D of the forming of the roof and the floor of the cavity, and plus the medial wall, which is forming the septum from the bone and cartilage. We will look here. This is lateral wall and the orifices, and here the cribriform plate, which is the olfaction here, plus the communication of the 4 sinuses. One of these sinuses, this is the sphenoid sinus, this is the frontal sinuses. Here inside there is what is called ethmoid sinuses, plus the maxillary sinus. In the opening here, each sinus is open in a special area, you see. If you look here, inferior meatus receive opening of the lower end of the nasolacrimal duct here, while the middle meatus or middle concha, it is also polyethmoida, which is the opening of the maxillary sinus. Hiatus minioris curved opening lying just below the poly, receiving the opening of maxillary sinus. Okay, it is a funnel shape. The superior meatus here opening the posterior ethmoid. As we see, we have anterior ethmoid, middle ethmoid, and the posterior ethmoid. The sphenoethmoidal recess here in this area, receiving opening of the sphenoid air. So this is all in the lateral wall of the nose, receiving drainage from the frontal, from the ethmoidal, from the sphenoid, plus the maxillary sinus and nasolacrimal duct. So 5 opening in the nasal cavity, which is receive any secretion from these sinuses, plus the eye through the nasolacrimal duct. The blood supply of the nasal cavity is through a branch from the maxillary artery, facial artery, plus the sphenopalatine artery, and there is an anastomosis here. The venous drainage, as you see here, the submucous plexus venous drain vein accompanying artery, as we described it in the maxilla. The nerve supply, we have secretomotor supply, parasympathetic, and we have special sensory supply, and we have a normal sensation. So we have a 3 cranial nerve involved in the nasal cavity. First, olfactory. Second, the 5th trigeminal nerve, and the 3rd one is the facial nerve, secretomotor, through the parasympathetic postganglionic. The lymphatic drain, it is a drain through vestibule and to the submandibular node, and the rest of the nasal drain to the deep cervical. So 2 parts, superficial and deep, to the lymphatic structure. This is the nerve supply as we describe it. The paranasal sinuses are 4 pairs, located in both sides of the face and internal deep, which is maxillary sinus, ethmoidal sinus, frontal sinus, and the back of the nose, which is called a sphenoid sinus. The sphenoid sinus, one of the characteristics is sit underneath the pituitary gland place. So the surgeon, sometimes if there is any pituitary gland problem, they went through the nose to the sphenoid by microscopic or endoscopic surgery, and to the place of the pituitary gland. This is the view of the sinuses. As we describe it here: maxillary sinus, ethmoidal sinus, frontal sinus, plus the sphenoid sinus. What the function of the paranasal sinuses? Why God subhanahu wa ta'ala made these sinuses here in this area, craniofacial region, the viscerocranium and neurocranium? They have many functions. أولا, lightening the bones، تخفف من العظم، من الوزن مع العظم، ولا يصير ثقل على الفقرات العنقية جدا، affecting the cervical vertebrae. Plus humidify, the warming inspired air، الاير اللي احنا هذا اللي هو الشهيق، انه هو يسوي له عملية humidification. The pressure, intranasal pressure, also regulated, contributed in the facial growth, also in increasing the surface area of olfaction, decrease the weight of the skull, as we described, shock absorber plus as immune system. The maxillary sinus is the biggest sinus which is present. And is like a pyramid. The wall of the nose and the apex of the zygomatic process of the maxilla. This is from the lateral side. Also, here from the apex, the zygomatic process of the maxilla, superior lateral is related to the orbit, anterior lateral is related below to the root of the upper molars and premolars, here in this area. The innervation by infraorbital and alveolar branch of the maxillary nerve. The blood supply of the maxillary sinus, it is by the orbital and superior alveolar branch of the maxillary artery. The drainage through the maxillary sinus, it drains the secretion through the hiatus similuni underneath the frontal sinus opening, and this is a potential pathway for spreading the infection. Fluid drainage from the frontal sinus and can enter to the maxillary sinus. Sometimes, if there is an infection in the frontal sinus, may be affecting the maxillary sinus because they are close together. You look here, this is the maxillary sinus, this frontal sinus, and the opening is here, very close. You look here also, very close together. Here, if you look at, this is the cadaver, and this is the CT scan, this is the opening of the maxillary sinus drain, and this is here the drain of the maxillary. So any infection that might sometime causing trouble to the maxillary sinus. The frontal sinus is smaller than the maxillary sinus. We have two, one in the left, one in the right, and a drain in the frontonasal duct. Sensation supplied by supraorbital nerve, a branch of the ophthalmic rate of the ophthalmic branch of the trigeminal nerve. The arterial supply through the anterior ethmoidal artery is a branch of the internal carotid artery. While the ethmoidal sinus, there are three types of anterior and middle and posterior. The anterior is open in the hiatus semilunar, while the middle is open in the lateral wall of the middle meatus, and the posterior open into the lateral wall of superior meatus. The nerve supply of the ethmoid are from the ethmoidal branch of the nasociliary nerve of the maxillary nerve and the maxillary nerve of pterygopalatine ganglia for the secretion as a secretomotor, and the blood supply from the anterior and posterior ethmoidal artery, which is supplying the ethmoidal sinuses. The sphenoid sinus, which is the most posterior sinuses, nearby to the hypophyseal fossa or pituitary fossa, as we said. And this is very important for the surgeon. If there is any tumor, they go through these passages, the arrow, to remove the pituitary gland from here. The innervation is a posterior ethmoidal branch of the ophthalmic nerve and maxillary nerve via orbital branch from the pterygopalatine ganglion. The blood supply is the branch of the pharyngeal, because it's very close to the pharynx, pharyngeal artery from the maxillary artery, as you see it here. Any question? Here all the orifices and the opening of the sinuses drain. The images of the sinus as you see it here, the frontal, the nasal septum, the maxillary sinuses here, this is the zygoma here, and superior orbital fissure here, this is the CT scan, see the nasal septum, and here also it's well divided, this is the coronal suture, this is what is called the horizontal section. Thank you very much.